health-wise, so we've realised early on in this that actually, I described it last time as like health is like a whole different continent that we realised we didn't know much about. So, you know, we initially joked at the beginning in saying when it comes to the MAC-PT, we just need a super nurse. And actually we realised that that doesn't exist and that all nurses are super nurses. So Zoe often describes it as kind of working backwards, and I think that we've done a lot of that when it comes to all of our partners really, but health definitely stands out as being the one where we maybe had to do a lot of working backwards with it. So we knew we wanted a health representative on our MAC-PT, and we've been successful in obtaining that. Obviously, we had to think about resource within that. So for us, our health nurse comes from a safeguarding background. So she's one of our safeguarding nurses. And we had to think about banding, which was all new for us to understand as well. So thinking about who was at that level where they could almost wear two hats. So a strategic hat in thinking about what data and what things we were looking at, how effective this role was, but also an operational one in being able to go out, visit families, offer consultation with our workforce, and do a bit more of that hands-on approach as well. So in terms of the releasing of that role, we were able to have a nurse join us for 2 days a week, and we're constantly thinking about how we expand on that. The feedback that we've had from health collectively has been that, you know, there's been some parts where it's been felt that we're only targeting one area and actually there's other areas to consider. But we've also recognised the need. We have a lot of steering groups now. So we've got an operational steering group and a strategic one. And we have health colleagues represented within each of those. But we actually recognise that health itself needs its own subgroup. So we now have a subgroup specifically for health, and we have a representative, our lead on health now we've identified as being our designated nurse within the authority, who is therefore in a really good position to be able to have that helicopter perspective on who we need to be bringing into that group and what that should look like. And I think we've had some really good examples of where that role has worked really effectively in making sure right support at right time, where our health nurse, our safeguarding nurse, she's been really good at being that bridge between. So where we've got maybe health talking about not understanding some decisions that are made by social care and vice versa, she's really able to kind of switch hats in offering those two different lenses and just explaining, you know, what those processes look like. Sometimes her most helpful approach is just having those consultations with workers where maybe they're, you know, we've got family health practitioners or social workers who are working with a family who just need to understand a little bit more about a certain condition or a different service to refer to. And so it's been some of those smaller, softer conversations that have really helped to ease some pressure and help us to focus on the preventative work, as opposed to escalating to strat so that we can gather that information. So yeah, it's been a massively helpful addition to the team, I think.